Hello, beautiful people. You're welcome to Fertility Expo Room. I'm Priscilla Sawe. Today's episode focuses on in vitro fertilization, which is popularly known as IVF. What is IVF? What are those steps involved? And what are those factors that affect the success rate? So stay with us. We are joined again by Dr. Charles Eromoseli, who will be guiding us through today's topic on IVF.
Thank you, Priscilla, for having me. Talking about in vitro fertilization, IVF. In vitro literally means something happening outside the body. Okay, when we're talking about IVF as regards humans, we mean that this fertilization, which by definition is the union of the male gamete with that of the female, to give us a zygote. Okay, what we'll try to do, simplify it as much as possible. Okay, which means the sperm unites with the egg, and then after a few times, or about 18 hours thereafter, you now have what we call a resemblance of life, or what I will call a baby or embryo. But at that stage, we call it a zygote. Okay. After about 2 days, we now start having what we call embryo, the cleavage stage. And by the fifth day, you have what they call a blast. Okay. Now, some people do transfer on day three, others do on day five. Okay. Talking about in vitro fertilization now, it means that this union, which naturally or spontaneously happens when a man meets with the wife, when a man has intercourse with the wife after she has ovulated, after she has released her egg, the sperm moving through the vagina, okay, passing through the cervix, through the womb, endometrium, and into the tube to reach the egg. At the beginning or the end of the tube is what one could say is in vivo fertilization, meaning it's happening inside the body. But if for whatever reason this does not happen, after a period, let's say 1 year, of regular intercourse, okay, without any preventive measure against pregnancy, then we say the person is subfertile or infertile. And if it is because the tubes are blocked, of course you will agree with me that any method that can bypass the tube to ensure that this happens will be ideal. All right, and one of the commonest way to do that is to do, since fertilization cannot take place within the body of the woman, then let us bring out the eggs like what we do here. We bring out the fluid, what we call follicular fluid, after giving the woman injection for some days, and then we have a way of assessing maturity of the egg. We bring out the fluid and we screen here. Talking about the steps of IVF procedure or process. Now, what we do is that first of all, in our own facility, we ensure that you are registered. You also pay for consultation, and then our experts interact with you for the first time. We take history. See, for instance, we want to know your age. We want to also know for how long you've been married. We look at your medical history, whether you have hypertension, for instance, you have this. If you are currently on any drug, for how long you have tried to get pregnant and how you have gone about it. Then, of course, we also ask the man this question, whether you have had children before, whether we ask about your occupation. We do all that, to be able to have an idea of why you are having difficulty with getting pregnant. Some persons actually present early, so it becomes so easy. After 1 year, as a matter of fact, if you are married for 1 year and afterwards you have regular or protected sexual intercourse, you should actually see your gynecologist. Okay. Then we also look at whether these couples have had any investigation, any test done before. pointing to the probable reason why they are unable to achieve pregnancy. After doing that, we run some tests. We look at your medical condition to see whether you have any medical condition that could affect you or your baby when you eventually get pregnant, or any condition that could prevent you from getting pregnant. The same also goes for the husband. As a matter of fact, some of the tests we have to look at your liver and all this because some of the medications you take have impact on your organs. When we are satisfied that okay, you can carry your pregnancy, we have done scan also to look at your womb and see whether you have any lesion or any mass, anything that could also affect your chance of having success with the procedure. We do all that. Right now, we routinely do seroscopy. We want to look at the endometrium. We want to see where we are going to position babies to be sure that the condition of your uterus is also good. And if there is any need to make any correction, for instance, if there is a polyp that could affect your chance of getting pregnant, or there are adhesions that will not allow your babies to implant or embryos to implant, we correct them before your procedure. Thereafter, it also depends on most of the time the age of the woman and the man, of course. Then we're looking at whether the egg reserve is okay. With this woman postmenopausal, with all the history, we're able to arrive at that and see, look at your chances with the different methods that we have. Once we have done that, we plan your treatment, and there it goes. All right. To God be the glory. Our success rate is very good. Is very good. To be without risking being immodest, our success rate is good. Looking at the factors that affect IVF success rate, there are actually many. Okay, it can be from the woman, it can be the man. This also they have to do with the quality of the embryo that we eventually get. Okay, talking about the man or the woman. If, for instance, we have lesion, the woman has a fibroid, for instance, that is close to the endometrium, that is the internal lining of the womb. If there are additions, for instance, these ones may actually impact negatively on the probability of implantation. Then the age of the woman. The age of the woman will actually go a long way to affect the quality, the quantity, and the quality of the eggs. Okay, but this factor is easily overcome by when we use younger egg donors. So that can easily be overcome. Then if this woman has a chronic medical condition, for instance, she has diabetes, she has hypertension, all these things are uncontrolled, yes, of course, it can affect it. The general state of health of the woman is also important. So the reason why what needs to be corrected should be corrected before the procedure is embarked on. Then for the man, the condition of the man can easily be assessed by the quality and the quantity of the semen. Okay, um, when the quantity, for instance, oh, this man has a very low sperm count, then the quality most of the time we actually do not assess, but it can be assessed the quality of the sperm. Whether there is DNA fragmentation, once it is up to 35% fragmented, the DNA of this, it affects the success rate. Okay, so we have a way of assessing all that. With all that qualitative, which of course they are too technical to be understood by our general our followers. So we try to simplify it as much as possible. But we're able to assess the sperm and of course know what to do. Sometimes we have to place them in medication to improve on the quality of the sperm. The general health status of the man is also very, very important. All right. Somewhere in summary, we can see that, look, if the quality of the sperm is poor, and or the quality of the egg is, I mean, it goes without saying that, look, it will impact on the quality of the embryo. Okay, we also have a way of assessing the endometrium. Endometrium can be of high grade. So most of the time, if you have a high grade endometrium as assessed clinically and a high grade embryo, okay, grade A, of course, your chances of getting pregnant is very high. But if the grade of the embryo is poor, most times even if the endometrium is good, then of course you are very unlikely to be successful with that cycle. All right. In summary, this is it. Yeah.
As we wrap up, we've looked at what IVF is, the steps involved, as well as those factors that affect the success rate. A very big thank you to you, Dr. Charles Iromosele, and to all our viewers. Please, if you have any questions, kindly drop them at the comment section. My name remains Priscilla Sawe, and this is Fertility Expo Room. Join us again next time. Until then, stay blessed.